It's well documented that the rate of COVID infection is higher for minorities and that pre-existing health disparities have made the impact more severe in those communities. Now the Trinity Project is providing much needed information that can be used to identify problems and help solve them. With more on that, let's go in depth with moderator Susan Godot and her panel of guests.
Thank you, Rich. Yes, this is an important topic. It's still an important topic, and we have two very special guests to help us wade through and get us up to date on what's going on today. First, I'd like to introduce you to Oklahoma Representative Jason Lowe. He is from Oklahoma City and chairs the Legislative Black Caucus in our state. And then we have Dr. Adam Alexander from the OU Health Center. He's the Assistant Professor of Preventative Medicine. I'd like to thank both of you for being with us.
Thank you for having me.
All right, so to start, I'm going to refresh. Well, it's been so long, it's hardly a refresher, but back in February, Dr. Alexander, we had you on to explain Project Trinity as it was just launching. I'm going to have you quickly refresh our memories. What is Project Trinity?
Yeah, so Project Trinity is a cohort study of African Americans living in Oklahoma. We're trying to look at the effects of the pandemic and also that period of unrest we all experienced in 2020. The idea is that, in that tumultuous year, it's important to study the health effects of it. Like what happens, when everything is shut down, churches are shut down, stores are shut down. What do people go through mentally? Does their health behavior change? And Project Trinity looks at that very deeply. I'm learning that when African Americans are injured or killed by police officers, that psychologically, that uniquely impacts African Americans more so than any other population here in this country. And so when I designed Project Trinity, I wanted to look at the problem where I thought it would matter the most. And that's what African Americans first and foremost. And once I showed that, there's something there that that's significant, then I would try to invite other populations like whites, like American Indians to take part in Project Trinity to see if we observe those same relationships or those same associations in those populations as well.
Representative Lowe, I just want to ask you, what is your take on this? Is this something that's needed here in Oklahoma?
Oh, absolutely. As leader of the Legislative Black Caucus, I hear every day of the mistrust that we have in the medical field, the mistrust that African Americans have in the judicial system. We need to research these issues. These are very important issues. We have the highest rate of incarceration in the nation. I think we're second now, which is still not acceptable. Every day I go to the courthouse, I see our young men and women, primarily African Americans, are being incarcerated for nonviolent offenses. These things have to change. And projects like Project Trinity, we need to promote, we need to support, because we need to find out what are the causes and how we can correct these measures.
So Representative, I want to stay with you for just a minute. One thing you said right off the bat was a mistrust of the medical system. Why is that?
It's just based on history. Tuskegee is based on racism. Systemic racism is just the history of African Americans getting the short hand of the stick. I know for a fact, my parents who are elderly, it took them a while to get vaccinated because of their mistrust of the medical system. And I'm a person that actually had COVID and suffered from COVID and being hospitalized for several days. But they had a mistrust of the system. And that goes along with plenty of African Americans throughout the state and throughout the nation, where they just do not trust the system.
So, Doctor, why do you call this Project Trinity, and explain what you did in the study?
Yeah, so the reason why I call it Project Trinity, because the byline for the study is health, hope, and healing. And so I think in order to really come up with a solution, you must first really understand the problem. And so that's why, as I said, I invited a sample of African Americans to take part in this 2-year cohort study. And, some of the questions we asked was about how often they watched television coverage or social media coverage of African Americans being harmed or killed by police officers since the George Floyd incident. And we also asked them how often they watched footage of a protest or even riots since the George Floyd incident. And from there, we asked a follow-up question that really got at, how emotionally impacted, they were by watching that footage. And then from there, we collected information about their current mental health status, their attitudes about policing, their attitudes towards civil disobedience and unlawful behavior, and also about, how socially involved they've been. And then, and then from there, we can do really cool analysis to see would that be associated or with your mental health or your perceptions about policing or civil disobedience, as well as your willingness to engage in political causes. And so it's just cool stuff you can do when you ask really good questions.
So Representative, we have study, and surely this isn't the first study that's been done. What has to be done beyond this study? And with would you say 7 members in the Black Legislative Caucus for Oklahoma, is that enough to affect change?
Yeah, that's the most members, unfortunately, that Oklahoma has ever had. But yeah, we need more individuals that are elected that believe in rehabilitation instead of incarceration, believe in criminal justice reform, believe that a person that commits a nonviolent offense, like being addicted to drugs, that hurts themselves, don't belong in prison where taxpayers are spending $20,000, $30,000 a year housing them when they could be out being a productive citizen as far as a taxpayer, supporting their families, and not having the system support them. So I think on the legislative level, we need to make sure that we talk to our legislators in rural Oklahoma who are Republicans, who are Democrats, and let them know that these are issues that are important to us. As a politician, I am held accountable to the voters, and we got to make sure that politicians are aware of this. And the voters out there, people that are listening to this, hold your elected officials accountable. Let them know that these are issues that are very important to you, and that you have to support these issues. And that's the only way things are going to be changed in this state. That's it. I mean, we just have to hold our electeds accountable.
Dr. Alexander, what were some of the solutions you found, if any, at this point? I think you may have more study to do.
Okay, so let's talk about the findings, actually. So let's first talk about the mental health risks. When you start viewing footage of African Americans being harmed or killed by police officers, or if you just view footage of protests and social unrest, what we find is that when you view footage, especially very frequently, of African Americans being harmed or social unrest, you have a higher risk of anxiety and depression. Now let's also look at attitudes. What we also find there is that when you view footage of either African Americans being harmed or killed, or footage of social unrest, you have more negative perceptions towards policing, and you also have more positive attitudes towards civil disobedience and unlawful behavior. And finally, what about political action? Do people get engaged when they see these videos? In fact, they get very engaged when they see these videos. We had high levels of political engagement among all our participants. So when we talk about solutions, the law enforcement needs to know these videos are not doing them any favors. They're actually, their public opinion among African Americans is going down every time people are watching these incidents, and they keep happening more frequently. And so I think the law enforcement, if any solutions were to come from representatives or people within our institutions, we need to be able to send out positive messages as it relates to law enforcement.
What I've seen as far as talking to young adults, especially African Americans, they're their opinion of police officers is not great. They do not want to be police officers. And my goal is to diversify the police departments in the state of Oklahoma, make sure more African Americans are applying for these jobs, because I think it makes a difference. When African Americans see other African American police officers, I think it helps. So what is your take on that? And did you ask that question in your study, or what's your personal take on it?
I can actually speak from personal experience because I actually come from a family of law enforcement. My father is a director of a prison. My older brother is a police officer. And my older brother, he didn't always, walk the straight line in life. And when you're applying for different police departments across the nation, they're usually looking for people who are squeaky clean in terms of their records. My brother didn't have a squeaky clean record, but because the law enforcement community gave him a chance, he was invited to join their ranks, and he succeeded. And not in ways in which one might expect. And so you're definitely right. We need to do more to get to diversify the police department. And I think one of the ways we can do that is just by really seeing, just by giving people a second chance. Allow police officers who may have not have the best past to give them a chance and bring them on the force. So I think they can do a lot of good work, especially when it comes to working within African American communities, because they can understand some of the language and behavior better than other people from other backgrounds.
It seems like we're talking a lot about social justice more than the medical end of this, and I don't want to leave anything out, Doctor, if there's something you want to add that's important, because the representative, talked about his parents being reluctant. Well, as in the African American community, there may be a special mistrust, which you guys addressed earlier. So what part of your study, what did you find in that part of your study?
Oh, that's a great point to talk about, that just the mistrust in the system. And like law enforcement, they're actually very similar. There's also very few African American doctors who are practicing today. And so when you have an African American patient, they're primarily going to be seen by doctors of other races, which is fine because we want to receive the best medical care. But I think that when you have an African American doctor, whether it's female or male, they're better able to communicate and really talk about the needs of the patients, of African American patients, in a better way. And so I think that may improve care in ways that you would not see if you were to have a doctor from another background. And I think that also may help to rebuild some trust there as well. And so, institutions that I work for are really trying hard to find and recruit doctors who are African American, because they also recognize that, their patients really benefit when they're treated by African American nurses and doctors. And so, that's just something we have to continue to work on.
So this sounds like it comes down to access to education and access to more opportunities in the jobs field, especially in those jobs that interact directly with all communities in the state.
Is that right?
Yes, no, you're exactly right. And as I said, the institution I work for, the Stevenson Cancer Center and the University of Oklahoma Health Sciences Center, they're launching a lot of initiatives to just build pipelines so that we can find those bright students and lead them into those careers so they can be the future doctors and the researchers. And so when people look up, they'll see more people that look like them, so they can also be inspired to go down the same road.
That's great. Representative, I'm going to give you the last word. As you look down the barrel of all the things that need to happen and all the possibility that lies at the end of that road, what is it that you would like to do in the next 1 to maybe 5 years in Oklahoma to help bring these changes to light?
Education is the gateway to success, and I think that's where it starts. We got to make sure that our schools across the state are all equal. Schools in my district, District 97, most of them are failing. That's unacceptable. We have a whole generation of kids that are not getting a quality education. So those things have to change. We have to focus on health disparities as well. That's why African Americans are so susceptible to COVID-19 based on diabetes and all other diseases out there that COVID-19 seems to love. So those are issues that I plan on focusing on in the next legislative session. the Black Caucus, the Legislative Black Caucus, we believe that we need to be the leader on those issues, and we plan to be.
All right. I want to thank both of you for being with me, Representative Jason Lowe and Dr. Adam Alexander. Thank you so much for your time and your insights.
Thank you again.